We'll start with a brief revision of what we have learned so far. So the first thing that we have learned, the first things that we have learned so far is about the basic procedures, or we can say the basic principles that we applied to PNF. Yes, and today we are going forward to see about the patterns. That is the last point in the principles. Yes, so we'll revise about what we have learned so far. Starting with the first, that is resistance. So the amount of resistance provided during an activity must be correct for the patient's condition. We talked about જ્યારે પણ આપણે પેશન્ટને અપ્લાય કરશું કોઈ પણ જાતનો resistance is something that you oppose. So if I'm doing shoulder flexion, I'll be resisting it. Yes, to oppose the movement that is occurring, that is resistance. And આપણે oppose કરશું એના માટે we have to provide appropriate, or we can say optimal resistance. Optimal means it should be very specific for that individual. Yes. Say for example, I am a normal individual, I can lift shoulder flexion with 5 kgs of weight. So amount of resistance for me, optimal resistance is 5 kg. But an athlete who is able to do more activities, yes, જે વધારે activity કરી શકે છે, who is used to lift 10 to 15 kgs, એની માટે આપણે વધારે force. As a therapist, we have to apply more force. Yes. So that is optimal resistance. It will change from patient to patient and condition to condition. Even a patient who is having paralysis, he will not be able to do complete flexion. Yes, so in within the specified range in which he is able to do, we have to provide the resistance, and appropriately whatever he can do appropriately, we have to provide the resistance. That is also termed as optimal resistance. I will not be discussing, I'm just discussing the main aspects, because in previous lectures we have already described what is the benefit of using the procedure. Second is irradiation and reinforcement. Irradiation is nothing when you ask the patient to do some activity that he is already used to, and through that procedure you initiate the contraction of other muscles. Say for example, shoulder flexion is there but elbow flexion is not there. So I will resist the shoulder flexion so much isometrically as much as possible, so that there is initiation of elbow flexion. Yes, the current or the stimulus flows from directly the shoulder to the synergist and to the other muscles of the other proximal or distal joint. We have discussed all this. Coming to manual contact. Manual contact is the ability to provide extroception. બહારથી તમે ટચ કરો છો પેશન્ટને, એનાથી directly you will get an knowledge, or the patient will get what he has to supposed to do. Yes, so according to that the patient will react. So your placement, your hand placement is utmost important. For that we are using lumbrical grasp as much as possible. This is the lumbrical grasp that we talk about. Flexion at the MCP joint, yes, and extension at the IP joints. Both the IP joints should be in extension. It is easier, and everywhere we are using the same stretch reflex mechanism. Body position and body mechanics. So if I am asking the patient to do something, okay, if I am asking the patient to do a certain activity, say for example we were learning about this pattern which is also termed as D2 pattern. Yes, just remember we are going to see the patterns in this lecture. Yes, so if the patient is doing this activity while he is lying down supine, so you will be facing in walk standing position, my legs are in walk standing, and after that I am grasping. Again, manual contact should be appropriate. I should provide resistance throughout the range of motion, and I should be facing in the shoulder and the pelvic region in which they are moving. જે region માં or જે pattern માં follow થાય છે, same regions માં I have to be there and move according with the pattern. Yes, so when the patient is doing this, if I'm lying down supine, yes, correctly, and I'm doing this, that means the patient or the therapist will be standing here and he will be in walk standing and trying to move the part along with when the patient is doing it. Also, commands and the tone of the voice will play an important role that we have already discussed. Then verbal stimulation, there are three main types of verbal stimulation. First is preparedness, that is you will demonstrate. આપણે પહેલા દેખાડશું patient એમને શું કરવાનું છે. Once the patient is comfortable enough, then we will start with the movement. That is second command, that is action command. And third, if the patient is doing something wrong, that is we have to correct it. So correction command or compensatory commands are to be given to the patient so that the movement is corrected. Vision. In vision, we discussed about two important mechanics. First, the patient has to see. Our brain recognizes only the movement. I can do this, but I cannot instruct my deltoid and biceps to contract to cause this. Yes, Mara brain ne, or for human beings, everyone, the brain remembers only the movement and not the muscles that cause it. Biceps શું કરે છે brain ને ના ખબર હોય, પણ elbow flexion કઈ રીતે થાય એને ખબર હોય. Yes, that is what the mechanics of vision is. So whenever the patient is doing something, may that be even passive movement પર તમે કરાવતા હોય, first technique that we are going to see in PNF also, it will be rhythmic initiation. In that we do passively, but we ask the patient to look at what we are doing and the brain senses it. Brain ને signals મળશે કે yes, this is how it is to be done. એને ખબર પડવા મળશે brain ને, and slowly and steadily more and more amount of voluntary control જે patient નથી કરી શકતું voluntarily, એ ધીમે ધીમે આવવા મળશે. So vision is important. Also visual contact of the therapist with the patient is also important. If the patient is continuously in contact, visual contact, it builds up confidence in the treatment, as well as it builds up motivation for the patient to do activities more frequently and with correct mechanics or correct principles. Traction and approximation. So traction is pulling apart and approximation is moving it towards each other. Bony surface is moving towards each other. We talked about proprioception. Proprioception is a sense of joint position. Joint કઈ position માં છે હમણાં એ sense ને કહેવાય proprioception. Further there are spatial receptors, proprioceptors. When proprioceptors ક્યાં located હોય, joint surfaces and capsule માં of the joint. Yes, so if these are the two joint surfaces, there will be proprioceptors, receptors, sensors જે sense કરશે proprioception, joint કયા position માં છે એને ખબર પડશે. We will either push it towards each other for relaxation purpose, or will move towards away from each other, that is causing the traction, that will again initiate the stretch reflex. Yes, so both mechanisms are through the stretch reflex. So here we talked about the joint moving, causing interneuron, causing alpha motor neuron to contract and muscle to contract. Traction and approximation, we have seen the same mechanics is there. After that we want to apply stretch. Now stretching, as you already know, not just talking about PNF stretching, for any stretching it is utmost important that we provide lengthening position of the muscle. Say for example I want to go for extension, yes, or you can say stretching of the biceps muscle. So whenever I am doing this passively, yes, what will happen? Stretch reflex will be there and there will be contraction of the muscle. Also opposite is true, reciprocal inhibition and okay. So two mechanics that we have already learned, autogenic inhibition and reciprocal inhibition. So autogenic inhibition, for that same muscle is contracting and then it is relaxing. Yes, after a forceful contraction the muscle has to relax. Remember these two techniques always. જ્યારે પણ કોઈ muscle contract થાય એકદમ જોરથી, એના પછી એને relax થવું જ પડે. That is autogenic inhibition. So we are contracting biceps. After it has contracted, it will relax. So when it is relaxing, we will stretch it, or it will be completely relaxed, so it will be stretched or lengthened in position. Also reciprocal inhibition. Instead of stretching the biceps, stretch the triceps. Triceps ne contract કરાવશો એટલે શું થશે? We will go for relaxation of biceps in the principle of reciprocal inhibition. Whenever there is a movement to occur, when agonists are contracting, antagonist has to relax. જ્યારે પણ movement થાય, agonist move થશે, antagonist ને relax થવું જ પડશે. The same muscle spindle senses it, sends signal to interneuron, interneuron sends signal through alpha motor neuron to muscle for contraction. And timing. The last thing that we have discussed in last lecture was timing. Timing, you have to give commands at specific time and at specific tone. Yes, so that if you want a better response, you increase the tone. Yes, if you are not concentrating right now, I should increase my tone that you should concentrate on the board. Yes, but if you are talking too much and I want you to slow down, I will give commands. Okay, fine, your doubt is good, but right now we are concentrating on the lecture, so my tone will be much more lower. So these are the changes. Also the timing is important whenever you are performing any motion. Say for example this motion itself, the pattern, D2 pattern, when you want to do it, first will be the fingers, then will be the wrist, then elbow, and then the shoulder coming to the opposite side, pelvis. If the patient is given commands simultaneously for all joints, there will be no confusion and the patient will be clearly able to do this movement. Now coming to the main aspect, that is patterns. Which are the patterns of upper limb and lower limb? Yes, upper limb માં બે ટાઈપના patterns છે, D1 and D2. Something that we are talking about from the starting is this, that is D2 pattern. Yes, and other is this pattern, that is D1 pattern. Yes, How they are, what they are, we are going to see. First, each pattern has 3 dimensions. Yes, it will either be a flexion or extension. It will either be abduction or adduction, or it will either be related to rotation, that is internal or external rotations. Yes. So whenever you are describing any pattern, D1, D2 pattern. Now, first of all, I would like to add. So if you are able to see, we have described 4 patterns for upper limb. D1 and D2 is just name. Yes. So D1 flexion pattern, D1 extension pattern, D2 flexion pattern, and D2 extension pattern. That is for upper limb. To describe it more appropriately, you will need to understand this diagram. But before going there, I'll just give you brief. This was about upper limb. Same thing applies to lower limb. Same વસ્તુ. એટલે કે 4 patterns છે. D1 flexion, D2 D1 extension, D2 flexion, D2 extension. D1 માં flexion extension, D2 માં flexion extension. Yes, this is what you need to remember for now. Same thing applies for lower limb. D1 flexion, D1 extension, D2 flexion, D2 extension. Yes, if you remember these names, it will be easy for you. Also, when we are talking about any pattern, say for example D1 flexion, so any સાથે abduction or adduction and internal rotation or external rotation હશે. Yes, so that has 3 components. જ્યારે પણ આપણે કોઈ પણ movement જોશું, whenever I am doing this movement, this is T2. I have already told you. Yes, so this is D2 flexion and this is D2 extension. Similarly, whenever I am saying this movement, તો એમાં જુઓ ફ્લેક્શન પણ છે, એબડક્શન પણ મારું આમ થાય છે અને એક્સટર્નલી રોટેટ થાય છે. Yes, so 3 components in one motion: flexion, abduction, external rotation. Flexion, abduction, external rotation. If I am doing opposite, તો એનું complete opposite થશે. Yes, so first was flexion, flexion opposite extension, abduction opposite adduction, external rotation opposite internal rotation. Yes, all the 3 components opposite easily. If you remember D1 flexion, D2 flexion એમને યાદ રહી જશે. If you remember D2 flexion, D2 extension એમને યાદ રહી જશે. Yes, similarly for lower limb also the same patterns will be there. Which are they? We are going to see next. One important thing that I would like to add here is whenever we say D1 flexion or D1 extension, it is the end motion. Yes, so if I am doing this motion, this is the end position. Yes, આ starting position છે, end position આ છે, તો આ પેટર્ન ને કહેવાય D1 flexion, because end માં flexion, abduction and external rotation થાય છે. એટલે તમને હું કહું કે D1 flexion છે, that means it has to start from extension, adduction, internal rotation, opposite. Yes, and it moves to flexion, abduction, external rotation. Yes, how we are going to see now. So movement occurs in a straight line in diagonal direction. You can see this is diagonal. Yes, this is straight, this is straight. Yes, this is horizontal, this is vertical, but this is diagonal, something that is cross. Yes, you already know what is diagonal. Yes, if this is a rectangle, this is termed as diagonal. Yes, something that is not conventional. So the same thing, these patterns are diagonal. This is say for example flexion, this is say for example abduction. Yes, this is diagonal pattern. It has no name. It is termed as PNF pattern. That is the main aspect. Why do we want to learn? Why do we want to do such a pattern? આપણે શું કામ આવી pattern learn કરવી પડે? Because all the activities that you do from morning to night, all the activities of daily living, you are doing in diagonal pattern. આપણે pure flexion નથી use કરતા, pure abduction નથી use કરતા, pure rotations use નથી કરતા. If I want to grasp anything that from here, I have to use a diagonal pattern. If I am doing this from here, this is D1 pattern. Yes, if I am doing this from here, this is D2 pattern. Yes, કઈ પણ વસ્તુ ઉપરથી નીચે રાખવી હોય તો આમાં D2 pattern થશે, આમાં D1 pattern થશે. Unilateral, bilateral patterns થવા માંડશે. Yes, so that is the main use. PNF patterns are functional patterns. Functional as in you can do and use them for everyday tasks. That is why we are using and we are learning PNF. Coming to the patterns for upper extremity. In this lecture, we'll try to cover the upper extremity. So this is D1, sorry, D2. You can see here. D2. Yes. So the first pattern is D2. Which are the components? Remember the components that are most important. Flexion, abduction, external rotation. Flexion, abduction, external rotation. But this is the end position. આપણે જે વાત કરી આ નામ હશે D2 પેટર્ન નું નામ flexion નું છે. That means it will be end position. The starting position opposite. Extension, adduction, internal rotation. I'm not sure you're able to see. So this is the starting position. No, this is the ending position. Flexion, abduction, external rotation. I have to start from opposite. Extension, adduction, internal rotation. Yes, with elbow in flexion and wrist and finger in flexion. Yes. જ્યારે પણ આપણે પેટર્ન નું નામ લેશું એ પ્રોક્સિમલ મોસ્ટ પ્રોક્સિમલ જોઈન્ટ અપર લિમ્બ હશે તો શોલ્ડર લોઅર લિમ્બ હશે તો હિપ એના ઉપર હશે પણ બીજા કોમ્પોનન્ટ પણ આપણે યાદ રાખવાના છે પેટર્ન ના નામમાં નહીં હોય. So flexion at elbow and wrist and fingers will be in flexion. So this will be the starting position. You move and it will cause end position, that is flexion, abduction, external rotation, elbow extension, wrist extension, finger extension. Yes. So that is what is the D2 flexion. Remember the terms. D2 flexion. It will not be given anywhere. If you want to note it down that you have to perform this motion with other components. બીજા components book માં પણ તમને easily નહીં મળે, nor have I mentioned them in the presentation. So it is advisable that you write it, that you note it down. Yes. Second, D2 extension, opposite. D2, જે આપણી starting position હતી for flexion, that will be the end position. Now so this will be the starting position. આપણે કરવાનું છે શું? Extension, adduction, internal rotation કરવાનું છે. Yes, with elbow in flexion, wrist and fingers again in flexion. એનું opposite આપણે કરવાનું છે, that will be starting position. So this will be the starting position. Yes. So if you remember D1, જેમ વાત કરી હતી D1 flexion, તો D2 flexion same છે, એનું opposite, nothing else. So starting position will be here. From the starting position here, flexion, 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 extension, adduction, internal rotation. Yes, see the components again. Finger flexion, wrist flexion, elbow flexion, moving it down, extension, adduction, internal rotation. That is the name. Extension, adduction, internal rotation. D2 clear. Yes, D2 flexion and extension. So whenever you are trying to do this, this is D2 flexion and extension simultaneously. Yes. હવે you will be telling કે આ પેટર્ન યાદ રહી ગઈ. Okay, અને એપ્લાય કેમ કરશું? So for application purpose we are going to probably I'll be demonstrating on a model. Yes, if possible in the next lecture, or if not I'll prepare a video and show it to you later on. So first thing, D2 flexion and abduction. Remember, whenever we are seeing D2 flexion, it is end position, not the starting position. Starting position will be opposite. Yes, and when we are seeing D2 extension, that is end position, starting position will be flexion, abduction, external rotation. Yes, this should be very clear. Anuj opposite છે D1 flexion. Only one component changes. Just a second. Okay. Moving forward to the second D1. Coming to D1 flexion. D1 flexion, just observe, there is only one change. There is change in abduction and adduction. If D2 is abduction, in D1 only one component changes, that is adduction. So, if this was D2, yes, this was D2. So D1 ma same position અહીંયા આવશે, nothing else. And opposite will be this position. Yes, so starting position is extension, abduction, internal rotation. Yes, this will be the starting position and moving it up. This is also termed as chopping. Yes, you are grasping something and bringing it down. Yes, so you are grasping something, bringing it down. Yes, ઉપરથી કાંઈ પણ લેવાનું. Yes, you are holding it this way, flexion. Yes, and bringing it down into extension. Yes, so this is also termed as chopping. Opposite of it is D1 extension. So D1 extension, if you are doing, this will be the end position. This will be the end position. Starting position will be this position. Yes. So first thing, you are grasping something from here. Yes. So flexion, adduction, external rotation, elbow flexion, wrist and fingers again in flexion. Yes. The picture also you can make it out. If I want to do extension, this will be the starting position. For extension, I'll be moving my hand into shoulder. If we do component wise, then finger extension, wrist extension, elbow extension, moving it into rotation, abduction and extension. Yes, so this is the D1 extension. Starting position will be flexion. Only difference between D1 and D2 is abduction and adduction. Abduction in D2, adduction in D1. That is the only difference. Now we will see how it is important. How we are performing these motions in everyday task. આપણે પેશન્ટને ટીચ કરી દઈએ, આખી પેટર્ન આપણે રેઝિસ્ટ કરીએ, સ્ટ્રેન્થન કરી દઈએ, પછી આનાથી પેશન્ટને શું એડવાન્ટેજ થશે. So first, this is the summary of flexion, adduction, external rotation. Now this is adduction. This is adduction. So this is D1. Yes, this is abduction in extension, that is again D1. Abduction in flexion, that is D2. And extension in adduction, that is again D2. So D1 flexion, D1 extension, D2 flexion, D2 extension. Memorize this, remember this. Anyhow, you are going to remember and provide these techniques to the patient when you are going to the clinical practice also. Specifically in stroke patients, when there is paralysis, stroke એટલે કે paralysis, when the patient is paralyzed, for that specific reason, for that specific weaknesses, you provide such ranges, such important PNF patterns. Why? Directly using these patterns, the patient will be able to perform various activities regularly. આનાથી પેશન્ટને બહુ જ ફાયદો થશે. એક્ટિવિટીઝ ઓફ ડેલી લિવિંગ ઇઝીલી કરી શકશે. Why? We are going to see. So first, flexion, adduction, external rotation, also termed as D1. Why it is important? You can see from the pictures itself. You can grasp anything. If the patient is doing D1 flexion, adduction, external rotation, the patient can comb their hair easily. Yes, it is very much easy to comb the hair. Yes, so this is also one of the pattern. This is D1 flexion. Yes, opposite, helping reach something nearby from this hand or from this hand. This is D2 extension. Yes, sorry, D1 extension. So sorry. So this is D1 extension, grasping anything from nearby objects. D1 flexion, this is combing the hair. Do not get confused in D1, D2. D1 ma adduction આવશે flexion ma, D2 ma abduction આવશે flexion ma. That is the only difference. Also you can see again flexion, abduction, external rotation. So here also combing of the hair is one of the activities that can be done. With D2 extension, you can see you can reach the pocket on the opposite side. Yes, opposite side na pocket પણ reach કરી શકશો. Yes, directly trying to grasp something from the other pocket or something that is placed on the opposite side. જ્યારે પણ પેશન્ટને પેરાલિસિસ હશે, say for example you are injured, your shoulder is injured. Yes, right side shoulder તમારું injured છે. So at that time what will you try to do? If I'm taking something or if I'm keeping something on this side, will you use this hand? No, you will not. Why? Because there is pain, because there is weakness. XYZ reason. Same thing. Paralysis હશે પેશન્ટને, ત્યારે patient will not be using that side. જે પણ સાઈડ અફેક્ટેડ છે યુઝ નહીં કરે, તો આપણે એને શીખવાડવું પડશે પાછું. Yes, so for teaching the patient to use that affected limb for the opposite activities also, this PNF patterns will be helpful. That is D2 extension and D2 flexion. Okay. Up till here, any doubt? Upper extremity, lower extremity? Yes or no in the chat, everyone? Do you have any doubt in upper extremity patterns? Okay, I would. Yeah, okay, I saw something. Can you repeat it? Okay, sure, we will repeat. Fine. Just remember these pictures, they will be utmost helpful to you. Yes, if you remember them, it is more than enough. You will know which components are to be added. Flexion, adduction, external rotation. Flexion સાથે adduction. That means it is D1 pattern. Yes, D1 pattern. You will start from this position. Yes, and move it down. Say for example, you are holding something and bringing it down. Yes, you are chopping it. Chopping it. Chopping is something like cutting. Yes, so this is like a cutting. You use a sword to move this way. Yes, so the same movement is D1. Yes, અહીંયાથી grasp કરીને નીચે ફેંકવાનું. Yes, grasp it from higher and keep it down. So same thing, if you are grasping, so flexion, adduction. This is adduction. This is abduction. This is adduction. Yes, internal rotation with external rotation with elbow flexion, wrist flexion, and finger flexion. Once it is done, do opposite. Finger extension, wrist extension, elbow extension, move into abduction, extension, and downwards rotation. Yes, so that is D1. Doing opposite, flexion સાથે abduction. Flexion સાથે abduction. Yes, flexion, abduction, external rotation, elbow extension, wrist extension, finger extension. Doing opposite, finger flexion, wrist flexion, elbow flexion, moving the hand into abduction, extension, internal rotation. This is D2 flexion and extension. Yes. Whenever I say you have to perform D1 flexion or D2 flexion, your starting position will be extension. We are naming the patterns with the end position, not the starting position. આ યાદ હંમેશા યાદ રાખવાની છે વાત. બરાબર? And this is how they will be helpful. Also, um, we are going to see the patterns here. What we have demonstrated is really better. એક બાજુ જ કરી છે આપણે. Yes, we are using only one hand. Yes, we are just demonstrating with one hand. It can also be done with both the hands. How it will be useful, for what activities it can be done, I will give you a hint in the next lecture. Okay, fine. I want you to do a task. Turn on your cameras, everyone. Hold your phone. Turn on your camera first of all. Do not turn on your mic. Yes, do not turn on your mic. Turn on your cameras first of all. Everyone present in the lecture should do it. Yes, okay. Very nice, very nice. I don't mind if you're just woken up, that's okay. Yes, so first thing that you have to do is demonstrate me D1 flexion. So you will start with D1 extension. How do you start with D1 extension? Everyone, turn on your cameras. Don't turn it off, please. Chopping method. Yes, holding it this way, bringing it down. Yes, moving it this way, bringing it down. Do it. Hold camera with one hand, that is fine. Keep it on a stable surface. Your wish, I don't mind, but I want everyone to do it. If you don't do it, you will not remember. You, as we said, આપણું brain movement યાદ નથી રાખ, I mean muscles ને યાદ નહીં રાખે. તમને આ લાઈન માં યાદ નહીં રહે, પણ once you perform, brain માં recognize થવા મળશે. And if you know how to do it, you will gladly give the patients the better treatment. Yes, so bring it up, bring it down, chop it down. Yes, this will be the starting position. Wrist extension, elbow extension, finger extension. Yes, do it. Yes, and opposite. Yes, trying to grasp something, throwing it down. Trying to grasp something from the back and throwing it down. Yes, component wise કરવાનું છે. This is the starting position. Wrist flexion, finger flexion, Elbow flexion, moving into flexion, adduction, external rotation. Keep it, do it everyone. With your camera on, please, with your camera on. If there is a mistake, if I can make it out, I can correct you. That is why I'm asking you to do it on camera. If you are not doing it correctly, I can correct it for you right now. Yes? And after that, opposite, from flexion to extension. Yes? So moving from flexion, this position, finger extension, wrist extension, elbow extension, moving the hand into abduction, extension, and internal rotation. D1. Okay. Fine. Okay, we'll keep it till here. We'll keep it till here. For D2, we'll practice. D1 and D2, we are again going to practice in the next lecture. Be prepared. You have around 30 minutes. So be prepared. We are going to do practicals. That is of the D1 and D2 upper extremity patterns. Then we are going to start for the lower extremity patterns. Yes? Okay. Any doubts till now? Everyone clear now?
Yes, sir.
Write it in the chat. Write it. You are asking me to repeat. I hope now it is clear. PNF is very important. Yes, if we do PNF again and again, if we repeatedly provide PNF to neurological conditions or even to some orthopedic conditions where range is limited for stretching purpose, if we do, it will create very good results. Yes, but provided you know the principles, you know the patterns, and you know the technique correctly. So, for two things we are already about to complete: principles and patterns. Almost upper limb we have completed, lower limb the next lecture will complete. But techniques is the third thing that we'll be learning very soon. Yes. Okay, fine. So we'll keep it till here. Okay. Have you taken the attendance?